This is QD Clinic. I'm Jack Cush with RheumNow. QD Clinic is brought to you by RheumNow.live 2025. You know, our meeting is way different than other meetings in that 45% of the meeting is devoted to you. It's all about the audience, the learners. 45% is devoted to discussion. That means panel discussions, Q&A time, polling, and cases. It's way more than you'll see at other meetings. That's why it's so interesting. We hope to see you there. This is a case of natural RA. RA being an unnatural disease, but can it be treated naturally? A 47-year-old female with both psoriasis and psoriatic arthritis for over 11 years presents with deformities, contractures, and 5 swollen joints. Her current meds include curcumin, boswellia, goldenrod, a non-dairy diet, St. John's wort, and 12 other natural products and nutraceuticals. She says in the past she took prednisone twice. It made her hyper and chatty, and she couldn't tolerate it. She had been offered by her dermatologist and other rheumatologists DMARDs or Biologics and said she read up on it. The side effects were scary. She did not do it. You figure this is going to be a challenge. This is difficult to treat RA, even though she's really not been treated. And I think when I saw this patient, my goal was to win her trust and get her involved in shared decision making. So I have to have an open mind as to what she wants to use for natural products and vitamins, etc. You know, this is a gigantic industry. It's 2023, it's a $159 billion industry. More than half of your patients are taking drugs that you may or may not know about, over-the-counter vitamins and supplements. And the question is, are they of any benefit, and what are you going to recommend to this patient? You need to know that the data on these products is not great. So in general, the U.S. Preventative Task Force says that there's insufficient evidence of multivitamins and supplements to prevent either cardiovascular disease or cancer in healthy adults. They recommend that diet and exercise is your best preventative. A 2019 NHANES survey of 30,000 patients showed that supplements had no effect on mortality. You remember we had Karen Kostenbatter 2 RheumNow Lives ago talking about the VITAL study where vitamin D and omega-3 was shown to reduce the risk of autoimmune disease, but that's risk, not control, right? But know that the VITAL study did not show that vitamin D and omega-3 had any effect on cardiovascular, cancer outcomes, or fracture risk reduction. And lastly, there is some data out there about the beneficial effects of curcumin and maybe berries like cherries and things like that, which have some COX-2 effects and antioxidant effects. But the curcumin network meta-analysis of 23 studies in 2,000 patients shows it was effective at lowering pain by WOMAC scores, overall pain scores, and the need for rescue pain medicine. So what would you do in this patient? Would you hammer on her and say, take a biologic or hit the road, lady? Would you try to gain her trust by giving her an evidence-based regimen and telling her not to take medicines that are not going to help her? My view on medicines that don't help is I need to say that they don't help, but if they don't hurt, the patient can continue it as long as it doesn't cost a lot. Cush rule number 7 says something like, the more the supplement costs, the less it works. That's kind of obvious to me that patients are surprised at. They think that they need to buy a better a probiotic, an $80 a month probiotic as opposed to a $20 a month probiotic. I like probiotics, by the way. I recommend, what's it called? PB8. It's about $20 a bottle for 2 months. It works pretty good. There's some evidence out there that probiotics may help inflammatory arthritis, RA. There's some evidence that says it doesn't work. So what I would recommend in this patient, based on my experience and my understanding of the literature, is I would recommend curcumin or turmeric, number one. I would recommend that she wants to take cherry pills. That's great too. That would take the place of maybe Advil or Celebrex. Number three, I would probably recommend an anti-inflammatory diet, meaning a non-gluten, non-carbohydrate or very low carbohydrate diet, or a Mediterranean diet, as those work really, really well. The things that she was taking that I would not support would be the Boswellia, the goldenrod, the non-dairy diet, which has not been shown to work, and many of her nutraceuticals that are out there. Again, bromelain, green tea, arnica, MSM, collagen, SAM-E, SAM-E3, antioxidants, CBD, ginger root, WD-40. I mean, it gets crazy when it comes to and glucosamine. I don't recommend any of those. And again, I do like tart cherry pills as a daily anti-inflammatory. And then instruct her on how to manage pain with either acetaminophen or appropriate use of over-the-counter nonsteroidals, making that safe. Once you have done her some respect and some good, then maybe you can talk her into the safety and potential benefits of therapies that she's refused to take. That would be my approach to the patient with natural RA.